of medical education is on clinical subjects. You will find a lot of development in the MCQs, banks, and other things for the clinical subject, medicine, surgery, gynae, ops, ENT, peds, and they are working a lot. They have done a lot of hard work. They have developed very large pools of questions, and they are doing a lot of progress, which is very good thing. I'm not saying that they are doing bad thing. They are doing very good thing. They are doing justice to their specialty. But when when we come to our when we see our own specialties, usually our specialties, especially specialty of pathology, various disciplines of pathology, it consists of usually two major portions. One is the clinical portion, which is almost similar to the other clinical subjects, and there is usually no problem in developing MCQs. And we all mostly are medical graduates, and we do not feel any difficulty in developing or sharing those multiple choice questions. But the real problem comes when we have to examine, or we have to teach our students about the non-clinical topics. You know, there are a lot of non-clinical topics which we have to handle. And I'm very happy to see a teacher from the forensic sciences also. There may be a teacher from community medicine also. So these specialties alike, they also in need of a good pool of their MCQs, which are not clinical. You will astonish to see wherever you find any guideline for developing MCQs, or any online MCQ development, they are purely clinical. They will start with the scenario: a 40 years old male having flana, flana, flana. So now in forensic sciences, there may not be a 40 years old male with the fever and all. There may be, but there may not be. There are many other things which they present. A community medicine teacher may not be using such type of scenarios. In their scenarios, they may be talking of some community having some problem. So we need to do a lot of critical thinking. Rather, we have to be creative for developing these MCQs. So, and everybody can do that. It's not a difficult task. I tell you, it's not a difficult task. The thing is that we have to think of out of box. We have to do creative work. We have to synthesize things. So that's why this session. In this session, I will try to stimulate you, or to persuade you to do creative thinking in that, so that we can develop our own MCQs. There may be such MCQs from international universities. You may find them, but for our own particular scenarios, we have to develop those MCQs. So the topic is construction of higher cognition MCQs for. Uh, the, no, this makes things more difficult when if you say higher cognition MCQs, that means the MCQs should be testing the critical thinking, problem solving aspects of the, or interpretive aspects of the candidates. So that makes more complicated. So but we will, inshallah, in due course of time, overcome these difficulties, not only in this session but in subsequent sessions also. I have invited not only fellows of CPSP, FCPS, but all other teachers, maybe MPhil, PhD, who have to submit their MCQs to the universities or their medical colleges for undergraduate and postgraduate students. So they will also be very important part of today's session. Now, let me tell you a little bit journey of the development of, or the how the MCQs were developed. Firstly, there were true false type MCQs. Then came when best answer MCQs, extended matching, case cluster, etc. These we will not discuss. But why the true false MCQs they died? You do not find any true false type of MCQs. when I appeared in FCPS Part 1 about many, maybe 100 years ago, 30 years ago, we had this true false type. Just to give you an example, uh, the first sentence in these questions was regarding pancreas. Regarding pancreas. Okay. Pancreas lies on this uh, part of the abdominal wall, true or false. Posterior to pancreas is this. The other relation of pancreas is this. Blood supply is this. So for every options, you have to give answer of true and false. So either it will be true or false. So there was a chance of 50% guesswork. And to it was said very interestingly in our medical education circles. This joke was very common that in true false question, if you answer all the question true, you are likely to get 50% marks, because examiners tend to make more true type of questions. So so that's why there was also negative marking in that type of question. But negative marking again is the counterproductive. It is not the solution for this. So with the passage of time, there is a demise of true false. And do not find them in any examination now. So this it's a great development. I don't know who is the inventor of this type of question. One best answer. Now, one best answer, you have to select the best answer. Do not have to select the correct answer. You have to select the best answer. All five options may be correct, but you have to select best out of those correct. And there are many types of it. A type, B type, case cluster, but I don't think we require it. But just to give you some extra information, that the one best answer MCQs which we are using in universities and CPSP, they are called A-type questions. One best type answer, A-type. Uh, Next, I want to tell you something about the anatomy of MCQ, because we will be using some technical terms or terms of medical education. So I thought it is appropriate to give you, tell you some of the terms which are associated with the various parts of the MCQs. For those teachers who are already medical education qualified, my apology to them. These things are too basic for them, but for others, I think this will be helpful. So one best answer, they are of, uh, this is a typical question. And you can see there are some parts of this question. As a whole, this question is called item. So when somebody says item, it means a question. It may be an MCQ, it may be a short answer question, it may be an essay type question. So in medical education, question is called item. So, so whenever you find this term item, it means question. So the most important part of the MCQ, one best answer MCQ, is STEM. STEM, which is also called scenario. The paragraph which is written at the start of the question is called STEM. Uh, in this example, I've made this example out of our own specialty, and it is a non-clinical topic, which is quality management. So a clinical laboratory manager is working on the measures like reducing turnaround time, improvement for specimen and patient identification, and test utility. I've chosen these examples from my book, which is already with many lot of people. So these examples are not confidential, and these are not from the pool of the questions. They are from the book. So the second part is called lead in. Lead in is very, very important, which is the statement which leads to the answers. So in this particular example, which of the following term best describes the processes? It is lead in. It's a very common, very common mistake that people don't. It's a very common mistake that people don't. Okay, it's a very common mistake that people don't write lead in, but the question is invalid, or you cannot you cannot use this question if you do not have the stem. You do not have the lead in. Lead in is very, very important. So next part is this. Excuse me for 1 minute. There is some problem. Okay. So then next part is called the options. Options means the answers which are written. So quality assurance, quality control, quality improvement, quality laboratory processes, and quality planning. These all are options. Now these options, out of these options, one is the best answer. Of course, there is one best answer. And the other four, they are called distractors. So if you hear this term, what is distractor? It is the wrong answers, which are wrong options, which you do not have to choose. And the best, other than best answer, these are called distractors, because ideally every option in the list should attract the student that मैं इसको क्या करता हूँ मैं ही तो हूँ जिसकी तुम्हें तलाश है तो they are the uh, they should be like that, that students should be distracted toward them, so that's why they are called distractors, while best answer is one, only one. Now, there are some rules for writing MCQs, general rules. Uh, First of all, the do's: keep STEM simple. And STEM, the scenario, the first paragraph, which is part of the MCQs. And you should use simple terminologies. Do not use complex terminologies or verbosities. Spell out acronyms. The abbreviations you are using, you should give the complete spelling of it, because the abbreviation may be new to some people. Use third person language. This is very important. You cannot use the term I was using this, or I was using that, or you, you cannot also use the term you. You cannot say you are going to uh, do this test. No, it has to be third person. The third person means the passive form. This is an international rule. And you should avoid negative phrases. That means you cannot say all of uh, the best, the most likely option for this is maybe falling, except. So except and this should not be used. And options should be five. In CPSP and most of the universities, the options are five. There are some universities which say four options, especially for undergraduates. But, but as you decrease the number of options, you make the question more prone to the guesswork. So the real success is to minimize the guesswork. If you use five options, the guesswork comes to 20%. So if you are using four options, the guesswork becomes 25%. So this is the international pattern. Usually we are using five options. And then options should be alphabetical. In CPSP, the policy is that the options should be alphabetical, and most of the other universities also use this. But this may vary from university to university. Some people may not be using alphabetical, but I personally think alphabetical order is better for options. Then there are don'ts: all of the above, none of the above. These are no more used. They should not be used. These are banned now. You cannot uh, use them as an option of the one of the five. Why? Because I give you an example. For example, there are four options above, and student is confident about the two, that these two are perfect. They are perfect. They are very much true. And he is not sure about option number 3 and 4. So he will definitely go for all of the above, because if more than one is true, that means all of them are true. So that's why it is not used. Any MCQ containing these two things, all of the above or none of the above, they are immediately discarded. They are not accepted. Then there are some other terms like least, not, inappropriate, except, unlikely. These terms should not be part of the lead-in. I told you what is lead-in. The sentence, which the statement which is just before the options. So these 4 5 terms or 4 5 words should not be part of your lead-in. If if they are part of your lead-in, your MCQ is not accepted. Of course, these are general things. No culturally biased, sexist, racist terms should be used. For example, if someone writes that in black people, they say like, no, you cannot use this term black. You have to use African, Caribbean population, etc. So you all understand what does this mean. Then item classification, or the classification of MCQs according to the cognitive process. Uh, I hope you know that MCQs are should be used only to assess the cognition or the thinking mental process. You cannot use MCQs to test the skills or attitude. I repeat, you cannot use MCQs to test the skills or attitude. MCQs are only and only for cognition processes. That means assessment of knowledge, only for assessment of knowledge. Uh, now Mr. Bloom is the pioneer in this classification. In early 1950s, he classified MCQs or any questions according to the cognitive process in three groups: C1, C2, C3. But later on, some other psychologists, education psychologists, they add so C4, C5. जी कुछ पूछना है आप लोगों ने अच्छा okay so but in at CPSP C4 C5 and C6 they are merged in C3 so at CPSP at least only three types are used: C1 C2 and C3 and C1 is recall memory uh, rote memory ratta lagane wala wo that is called C1. C2 is interpretation when you have got some clinical symptoms, some problem, some laboratory data, etc., and you want to reach to some conclusion. While problem solving or C3 is when you have got multiple information. For example, you have clinical information, you have laboratory information, radiology information, and you put in a puzzle, and you want to reach to a conclusion. Or if there is an action involved in it, it is also called C3. So I hope you have some introduction, though, for those who have not attended any course on medical education. It was for them that C1 is recall and C2 is interpretation and C3 is problem solving. Just remember this thing. Now, example of the C2, this will make you some make you understand it better. I'm giving you three examples of C1. Of course, the examples I have taken from chemical pathology because today mainly are attending people are pathologists. Which of the following is most common cause of a random error? Change in reagent or calibrator, lot number, deterioration of reagents or calibrator, and fluctuation in power supply. This is the best answer. So this is C1, but it is not required. If you make such type of questions, it will not be accepted. by CPSP and by other universities also. So how we can, now, the challenge is that you want to assess this particular competency of assessing whether the student has the concept of random error or not. So uh, you can't use C1 type. How to make it to C3 or C2 type? The same question, the same aspect, the options are same. We have to make a scenario. So I've tried this to this scenario. You may agree or may not agree to it. So I'll read it. A batch of 25 specimens was analyzed for glucose using semi-automated chemical pathology analyzer microlab. The QC results were okay, but result of one specimen was 42 milligram per deciliter. Duty resident checked the clinical details of the patient and immediately realized that it was a random error. Which of the following is most likely cause of this error? The options are same, but you have made it, converted into a problem, a scenario. It looks like a problem has occurred at some point during the laboratory process. So this is simply converting a simple test of a recall to a problem solving thing or interpretative thing. According to my opinion, it is a C3 level question, not C2, which is quite high cognition. It is testing quite higher cognition function. So by this converting it into a scenario or a problem, you make convert it from C1 to C2 or C3. So how we can do it? It requires, as I said earlier, it requires some critical thinking. You have to alone for some time. You have to read the material. You have to extract the basic knowledge in that material, and then you have to make the scenario. Second method, which is easier, is that in your day-to-day practices, such things do happen. Sometimes instrument get faulty. Sometimes there is a result in error in the result, etc., etc. So you just record those incidents and convert it into a nice C2, C3 MCQ. I tell you, this is an easier method for making MCQs. Second example of C1 is, which of the following purification techniques is required to obtain reagent grade water? And there are options, and reverse osmosis is the best answer. Now, but it will not be accepted as such. So how to convert it? Now, please, you can comment it afterwards also, that if you like it or you have some objection to it, yeah, it is open to criticism. But I have tried to convert it into C3. A lab manager wants to install new equipment in her lab to obtain reagent grade water. For purification of water, she wants to use an instrument based on a process in which water is forced to pass through a semi-permeable membrane. She should procure an instrument based on, and the options are same. And now you have converted a C1 question into C3 question. With the practice, with mutual discussions, deliberations, we will, inshallah, be quite familiar and will become expert in making such type of questions for non-clinical topics. Third example is, which of the following containers containers the phlebotomist should fill first to avoid EDTA contamination? So there is a direct question. Which of the following containers the phlebotomist should fill first to avoid EDTA contamination? And 1, 2, 3 you can use, but it is again it will not be accepted. Same question, same knowledge aspect, it has been converted into a C3 level MCQ. A 42 years old female has reported in laboratory reception with the request of following test. The name of tests are given, and then which of the following containers the phlebotomist should fill first. So same aspect, and you have made it into a problem. It looks like that actually this problem has occurred in a laboratory reception. So that's why the universities or the medical education people stress on making such questions, that it will reflect your experience, your working atmosphere where you have been working. Have you been dealing with the on-ground problems or not, or have you just read the books and then you can answer the recall type questions? But if you are worked in a particular setup, only then you can answer with confidence such type of C3 questions. So once again, you have to do a little mental work, critical thinking, and convert it into a C3 level question. Uh, Now, this question also appears a clinical question. So I'm not saying that you cannot use the term patients or use clinical things. You may use it. So for example, uh, when we will be discussing the analysis of methodology, there may be a lot of clinical things which will be incorporated. Recently, some junior consultants, uh, Dr. Saleh and Dr. Tadaf, they have sent very good questions of analytical methodology. They are scenario based. I have not gone into details. Now I'll request them to put those questions on the online system. Okay, now coming to the next part of my talk is for FCPS people, the fellows. They may be fellows of chemical pathology or other specialty fellows, because these is the recent development of policy at the CPSP. You all know that for becoming supervisor, you have to submit 50 MCQs. It's a mandatory, and submission can be done from now any place. The MCQ submitted by email or courier will not be accepted. You have to submit online. So online submission is the only way now you can submit your MCQs, and you have to submit 50 MCQs. And so if you send by email or by hard copy, they will not be accepted. In chemical pathology, we are in dire need of uh, MCQs of paper one. Alhamdulillah, we have got more than 850 reviewed MCQs for paper two. That means the clinical paper, the pathophysiology paper. So we do not require uh, for MCQs for paper two, the clinical paper. We badly require MCQs for non-clinical paper, which is we know the topics, analytical techniques, methodology, sector lab management. So we will accept only those MCQ which are for paper one. We will not accept. I tell you, I repeat, we have categorically told CPSP that for chemical pathology, we will not accept MCQs which have been written for paper two. We will accept only MCQs for paper one. And after mutual discussion with CPSP, they have agreed that they will accept C2 MCQs, but they will not accept C1 MCQs. They may not be C3, but you can make C3, but at least it should be C2 level. But this is important, and I think they are right that we should not make C1 type MCQs, and they will not accept it. So, what is the basic difference between C1 and C2 question? It is this scenario. Uh, C1 question may be starting with just one sentence, but in C2 or C3 question, essentially there is a scenario. Now, how these questions will be reviewed, just to enlighten you the review processes. This is not a new thing. We have been doing these reviews for the last maybe many years. And there is a structural review which is done by medical education department. Uh, Probably last year, the CPSP invited me and other medical educationists to carry out structural review of a large pool of MCQs for Oman, which CPSP had developed. So structural reviews are carried out by medical education, but they have developed the online software in such a way that very minimum or maybe no structural review is required now. The only review will be technical review, and technical review will be uh, you cannot do it at home. For technical review, you have to go to CPSP headquarters at Karachi or or the regional centers, and no review from home, because there is an element of secrecy in it. So one senior chemical pathologist will, or any pathologist or any special teacher, they will be given the password by CPSP. In one center, for example, in Islamabad, only one pathologist or one senior specialist will be given the password, and two junior consultants of the same specialty will be present for the review. So review is a very important process, and the questions are made available for the examination pool only when they are reviewed and they are accepted. Now I'll demonstrate you how to use the online submission through ePortal. So all of you are who are fellows. They, I hope they have got the password, and if they do not have password, you have to write CPSP to give you the password. So this is the I'm showing now. I will be sharing with you this site. Just bear with me for 1 minute. I'm trying to share with you the site, CPSP site, where you can. Okay, so this is the uh, CPSP portal. You go to the CPSP website, uh, and then you will find an portal icon. You click it and go to it. Now here there are three options. Either you can go as a supervisor or trainee or fellow. You have to go as a fellow. So you will use this fellow. Here you will write the fellowship number and then the password. For the if you do not have a password, you have to write CPSP and they will send you password by email. So after login, this screen will appear. It has got several things. For trainees, your trainees, you also use this same portal, and I've been using it for quite some time. And now here the icon questions for MCQ Bank. So the first screen which appears gives you the record, how many MCQs you have made till now, and what are its details. So I'll start with the add new MCQ. So add new MCQ. The first thing is your category. I'll advise you to for those who are yet to become a supervisor and they want to fulfill the requirement of supervisorship, they should click this one. For other senior people, they can go for contribution to MCQ bank, the second option. They can use it and they can contribute to the MCQs. But uh, I think we should help assist our junior consultants who are in the process of getting supervisorship. We should give them a chance that they should submit MCQs so that the number 50 should be completed as soon as possible. Specialty, of course, is chemical pathology, and you will select chemical pathology here. Now, subspecialty, they have written some topics. They are good, but it is not yet complete. For example, they have not written the analytical methods. But I've talked to the CPSP Department of Medical Education, Dr. Sir. They say whatever you will want, we will add in the list. So after this talk, you will send me your suggestions, and we will compile them and send to the CPSP. Example is that in this particular list, they have not added some very important categories. For example, the analytical methods. So what if you, for example, want to make MCQ of analytical methods, you will use this option of miscellaneous. If you in lab management, you can also use this. Lab management, they have got the option for lab management. So uh, for for anything which you do not find here, you can use the option of miscellaneous. Then is theme. Now theme, this is purely clinical thing, and this is my main objection to CPSP. Our main objection to this. We do not, we are not making MCQs of clinical topics. So pain, breathlessness, swellings, they are not concerning with us. So what we will write here is, you can write, for example, you are making analytical methods. So you can write methods of glucose estimation. And one more thing, I'll advise you to write paper one. This will help us to sort out that how many questions we have got for paper one. Otherwise, I'm suggesting them to create a drop list here. For,
में कर दूं, आपका Zoom है application?
जी पार्डन क्या कह रहे हैं? डॉक्टर अफसा कुछ कह रही थी आप?
Okay. नहीं सर, सॉरी, हम थोड़ा सा लेट हो गए, तो इसकी रिकॉर्डिंग पे ताकि स्टार्ट से हम देख सकें, अगर रिकॉर्डिंग मिल जाए बाद में।
हाँ मिल जाएगी मिल जाएगी। अच्छा, अब उसके बाद यहाँ पे आप व्हाट यू विल डू इज you please write here that you are making it for paper one. For sub theme, it is again very tricky. They have given the list which is not concerning with us: diagnosis, treatment, investigations. So they have agreed that we may send them the list and they will add to it. But I have said them that you give an option of a blank thing, so that we can type whatever we want at that particular thing. For the time being, you will select this thing, D-Rain Basic Sciences, because it is an essential. You see, it is, there is star on it. It is an essential part. So you have to select any one of them, and the CPSP said that you can use this D-Rain Basic Sciences, although it is far from what we want. Then comes the scenario. It is a typical clinical scenario, but you can delete it and you can make your own scenario here. For example, any scenario you can use. Okay, let me bring a scenario from the presentation. So I have selected a scenario and I'm pasting it here. Okay, everybody can see it. Okay. Okay. And here lead in, this is again a very much big problem. Their leads in are only very much restricted to their clinical things. Most likely pathophysiology, most likely this. So you, for the timing, you will select this. The most likely D-Rain Basic Sciences in this case could be. Well, this is not correct, but we have no other options. Until and unless we add our own lead-ins, this is the only option left that you can use this lead-in. Then the options, they are simple. All the, anyone A, B, C, D from your MCQ, you will write the options there, and the key and level of cognition, at least C2 or C3, and importance. I will advise you to select this important because 80% questions should be from important part, and the difficulty level may be hard, may be soft, but majority of the questions should be moderate difficulty. Reference, you cannot give reference of articles. This is a problem. Either it has to be a textbook or a guideline. So if a textbook, you will write the name of the book and the current edition, chapter and page number. Not a very difficult thing. What I will, you can take a reference from same book. You all your 50 MCQs, maybe from TEEDS, maybe from Kaplan. There won't be any objection because, but the page number should be different. So if you consult my book, Chemical Pathology for the Beginners, and you can use those references, and the page numbers are also given there. That will save your time. This is important thing. That there are two options: draft or submit. If you have not yet completed the MCQ and you want work more on it, you will select draft. Okay, but if you think it is done, you are done and the MCQ is complete in all aspects, you will select this submit. I will select draft and submit it. There is an error. Yes, topic. So I will select the topic. This is again a lot of problem. They have given a good list of chemical pathology topics, but not complete. So they have not put the topics of paper 1 in it. So you can use this miscellaneous special diagnostic. Okay, miscellaneous special diagnostic for the time being, until unless we complete the options. So we have to put the all the options A, B, C, D. Only then this question will be accepted. So let's complete it and put some options in it. Reverse osmosis, then boiling, rather boiling should be here, distillation, double distillation, and then reverse osmosis, and then fine exchange, UV, sorry, UV treatment. So we have completed the option list and we can select the D here and teats, 2012 chapter, let's say, I'm not sure which chapter it is, and let's say it is 450. Okay, and we will submit this question. So it is submitted now. Okay, just to give you another example, I made just a sample question earlier also, and I'll show you that. This was a question related to the laboratory techniques or instrumentations. Again, the topic was miscellaneous, and optical techniques, paper 1 was the theme, and D-Ray in basic sciences. And scenario was a chemical pathology autoanalyzer has rejected the blank cuvettes before the start of analysis with the message qubit check fail, dirty qubits, as use of dirty qubits can lead to inaccurate test result. The most likely, this lead-in is not good, but we have to use it. So these are the four options, and the cognition level is C2, key is D delta, and this is the reference, and here the question is in the draft form. So when you complete the question in all aspects, you will select the submit button, and then it will go to the reviewer. So this was all I wanted to share in this session. If you have any questions, please let me know. Please don't get depressed. Don't get what you say, depressed and concerned that how it will be done. Only first 4 or 5 questions will be difficult. Next 40, 45 will not be those difficult. And I'm and other senior teachers, we are always available for you to help. Thank you very much. Now, any questions? Any questions, please?
Thank you very much, Brigadier Ijaz, Professor Mulazim. Thank you so much.
Okay, sir. Thank you. Thank you. Sir, I'm honored that you gave time and you are present here. Okay, if there are no questions, thank you. जी शनाब।
अस्सलाम वालेकुम सर। अस्सलाम वालेकुम सर मैं डॉक्टर सालिया हूँ केएमसी से। सर मैंने क्वेश्चन भेजे थे सर, सब लोग हैं हम लोग यहाँ पे।
अच्छा ठीक है,
मैम के ऑफिस में ही है।
प्लीज पूछें।
सर हम लोगों ने भेजे थे सीपीएसपी ऑफिस, मेरे 50 एमसीक्यूज वो एक्सेप्ट हो चुके थे। अच्छा, अभी लास्ट ईयर एससीएमटी का कोर्स किया था हम लोगों ने मेडिकल एजुकेशन का, तो उसमें जब मैंने बनाए उसी पैटर्न पे, तो उन्होंने सारे मेरे लीड इन जो है ना, मेरी मेंटोर ने वो सारे एक्सेप्ट नहीं किए। उन्होंने कहा कि लीड इन शुड बी स्टार्ट फ्रॉम व्हाट, ओनली व्हाट, ना हाउ से ना विच, मतलब कोई भी जो क्वेश्चन है आपने व्हाट से स्टार्ट, तो इससे तो काफी डिफिकल्ट हो गया हम लोगों के लिए सेंटेंस कंपोज।
ये ऐसा कोई चक्कर नहीं है। वो अब जो हम डायरेक्टली डीएमई डिपार्टमेंट से कोऑर्डिनेट कर रहे हैं।
सर मैंने भी उनको कहा कि मेरे सीपीएसपी से एक्सेप्ट हो चुके हैं, और उन्होंने कहा इंटरनेशनल ये वर्ड वाले जो होते हैं ना वो सबसे ज्यादा
जरूरी तो नहीं है सर। चलो वर्ड कर लें, वो तो थोड़ा बहुत उसको वर्ड्स को आगे पीछे करें तो वर्ड भी आ जाएगा।
डॉक्टर नदीम बात कर रहा हूँ।
प्लीज प्लीज।
डॉक्टर नदीम बोल रहा हूँ।
थैंक यू नदीम, आप तो बल्कि हमारे उसमें मेंटोर में शामिल हो इस एमसीक्यू डेवलपमेंट में। जी प्लीज।
भी बनाया था द मोस्ट लाइकली मेडिकल साइंस जो भी था इज, इसको अगर इस तरह हम स्ट्रेट अवे कन्वर्ट कर सकते हैं, व्हाट इज द मोस्ट लाइकली कॉज, व्हाट इज द मोस्ट लाइकली। इतना मुश्किल नहीं है,
मुश्किल नहीं है। बिल्कुल।
हाँ, लेकिन बस वो ना व्हाट ही चाहिए, ये ठीक कह रही है।
ठीक है। और लेकिन देखिए ना, उन्होंने जो लीड इन की ऑप्शन डाली हैं वो हमारी है ही नहीं, वो अभी हमने डलवानी है। बल्कि उसमें मैंने उन्हें कहा कि ब्लैंक वाली लीड इन डाल दें, तो वी मे राइट आवर ओन लीड इन फॉर अदर क्वेश्चंस।
क्या कह रहे हैं
सर? एक और मेरा एक ऑब्जर्वेशन थी, अगर आप इजाजत दें तो बोलो।
प्लीज।
जो नए लोग हैं उनके लिए थोड़ी सी आपने मुश्किल नहीं कर दी कि टोटली आपने कहा कि 50 के 50 पेपर 1 के करें, ठीक है, आसानी तो हो गई, लेकिन उन विचारों के लिए इसमें बनाने मुश्किल होते हैं। अगर थोड़ी सी उनके पास
60-40 कर दें, कुछ तो परसेंटेज कर दें।
मेरी बात सुने। देखिए सबने एफसीपीएस किया है माशाल्लाह। देखिए अभी हम एफसीपीएस की बात कर रहे हैं ना, उन्होंने सुपरवाइजर बनना है और एफसीपीएस में उन्होंने दोनों पेपर पास किए हैं। ये जो है ना डॉक्टर बनना खेलना ये बहुत आसान है। वो इधर उधर से मिल जाते हैं, उनको टॉपिक्स भी मिल जाते हैं, तो वो अपना वो पूरा कर लेते हैं। और वो देखो ना, आप उस मीटिंग में थे, दे टोल्ड अस दैट यू हैव गॉट about 850 reviewed question and maybe 250 more which are under review. So we do not need those questions. So first let it go, let them try on it. In special cases we may consider it, but I don't think it should be difficult, and with little bit of critical thinking they will be able to make it. So first go for it. जी क्या कह रहे हैं?
अस्सलाम वालेकुम सर। मैं ये कह रही थी कि अगर 50 क्वेश्चंस इकट्ठे बना के एक बार में बैठ के इसको सबमिट करना पड़ेगा या एक बन जाए उसको सबमिट करा दें फिर?
नहीं, जितने भी एक दिन में ऐसा कोई
एक ही दिन में कर?
नहीं
अच्छा।
नहीं, जितने भी आप करा, किसी दिन 10 कर दिए, किसी दिन 5 कर दिए, घर में बैठ के करना है आपने। तो सिर्फ रिव्यू के लिए वहां जाना पड़ता है, सबमिशन तो आप कहीं से भी कर सकते हैं। ये तो अच्छी बात है इसकी। ठीक है,
थैंक यू
जी। नहीं, ड्राफ्ट वहां नहीं जाएगा, ड्राफ्ट तो आपके लिए है कि अभी काम कर रहा हूं मैं इस पे। सबमिट में वहां जाएगा।
ड्राफ्ट तो उस वक्त होगा ना कि आपने अभी इनकम्प्लीट है और दोबारा मुकम्मल करना है, ऐसे है ना सर?
बिल्कुल बिल्कुल। ड्राफ्ट तो ये है कि अभी
मतलब है
इनकम्प्लीट
वो चला जाता है।
है। हाँ, सबमिट का मतलब है कि हो गया। बिल्कुल सर, ऐसा ही है। और कोई क्वेश्चन? थैंक यू वेरी मच। आप लोगों का बड़ा टाइम हमने लिया और आपकी प्रेजेंस वाज वेरी गुड और रियली वी।
और आपका शुक्रिया, आपने इतनी अच्छी इन्फॉर्मेशन दी बच्चों को, खासतौर पे
थैंक यू
नौजवानों
वेरी मच
को।
सर, माशाल्लाह।
वेरी मच सर।
30 के करीब।
थैंक यू प्रोफेसर आमिर एजाज, वेरी गुड मतलब सेशन मतलब जनाब वी हैव लर्नड मतलब जनाब स्पेशली दिस इज फॉर यंगस्टर्स
जी,
एंड द इनिशियल फेज मतलब जनाब दिस इज वेरी इंपॉर्टेंट मतलब
थैंक यू वेरी
जनाब दिस
मच।
इज
लास्ट मेरा
एरा ऑफ द मेडिकल
डॉक्टर शौक, इस तरह के सेशन आप भी करवाएं अपने पैप सेशन पे।